Welcome back. This segment is brought to you by the Center for Plastic Surgery, located on Michigan in downtown Grand Rapids. When you have a baby, your body goes through a lot of changes. Dr. Scott Brundage from the Center for Plastic Surgery is here to show us some of the options when it comes to mommy makeovers, and by changes, some for the good, some not for the good, correct?
Yeah, it's mostly all for the good. The difficulty that most ladies run into after having pregnancies is that there's certain irreversible changes that occur in the body. Typically the two areas of concern are the breasts and the abdomen, and I think today we're going to talk about the abdomen.
Okay, sounds good. Now, what are typically, when women come and see you and they say, okay, Dr. Brundage, I need some help, what are they looking to do to their abdomens?
Well, the typical concern that they have is that they state to me that they've, after they've had the child, that they exercise and do different modalities, but unfortunately they just can't change the appearance of their abdomen.
Right. It always seems to be like those last couple of pounds, or that your stomach just doesn't get quite as flat as it was before, unless you're a celebrity and have a live-in Pilates trainer and chef and all that good stuff.
Yeah.
Now, you also have a couple of pictures here too. Now, some of the options, there's things like lipo that are an option, correct?
That's correct. There's three different options that are available, and it really is dependent upon the anatomy of each individual that is changed.
Okay.
The simplest thing is liposuction. Most people after pregnancy will also get some redundant or extra fat. Usually it's in the lower abdomen, and if that's the only thing that has occurred and they have good skin tone, then you can simply just do liposuction. All these procedures are done as an outpatient. A liposuction procedure can be done under local anesthesia with sedation, whereby the tummy tucks are done under a general anesthetic. With a tummy tuck, you divide that into two different types of procedures. There's a complete tummy tuck, and there's also a mini tummy tuck.
Okay.
And that's really dependent upon the area of concern. If it's just your lower abdomen, oftentimes we can get away with a mini tummy tuck.
Okay.
But the most common is a complete tummy tuck, where the whole entire abdomen is done over.
Now, how far, like say you're a new mom, how long do you have to wait after having a baby? Can you do things like the lipo or one of the tucks? We've got some pictures of these too, if we can bring those up.
Sure. Well, the most important thing is you should not be having any further babies.
Yes, that would be helpful. Yes.
I don't really want to do the surgery on you and make you look good, and then you go back and you destroy the result. So
it's
you
kind
really
of like a beautiful painting that, you know, gets something splattered on it.
Very good. Yes. So once you're done with having children, and then you probably should wait a minimum probably 3 to 6 months from the completion of the birth.
Okay.
Let things stabilize, and then we would go on to the surgery.
Is this one the lipo here?
This is liposuction here, and this is whereby you're just simply removing the extra fat.
Yes, that little area right in, that little pooch in your stomach.
Yeah, and it's mostly on the lower abdomen in this particular picture. But this is the simplest of the three procedures.
Now we also have some pictures of the tummy tucks, some kind of befores and afters too, so if we can take a look at those and have you describe those. Oh my gosh.
This is the mini tummy tuck.
Wow.
And if we could see the side view, it looks a little bit better. You can see on the lower abdomen is the problem, and the difficulty you run into with a pregnancy is that you have irreversible changes of not just the skin, but also the muscles. The muscles of your abdomen get split apart, and people try to exercise to flatten their stomach, but unfortunately it does not change because the anatomy is changed, and we have to put it back to what it was before the pregnancy.
Now, I also want to make sure we talk too about, like, this isn't just, I mean, you have to work along with this, so you can't just get the lipo, or you can't just get the tummy tuck and be like, oh great, I'm good for life. You need to make some important changes in your life too, right, in terms of, you know, making sure you exercise and eating properly.
Oh, sure. Yeah, so I can change your anatomy, but you need to maintain it by maintaining your weight. And but the significant change, I need to say, unfortunately, is what I do. But exercising is still helpful.
Yes, get out there and move a little bit. All right, sounds very good. Thank you for all the information.
Thank you for having me.
You can find more on the Center for Plastic Surgery on our website. Just click on the Makeover Week icon. Up next, see how to refresh your skin with some chocolate. Stay with us, please.